Hi, we're your nurses, Melody Cooley
and Casey Guajardo.
We look forward to seeing you.
Every Sunday, you will submit answers to a screening questionnaire online, and every day before you come to school, you should be checking your temperature and that you don't have symptoms from the screening questionnaire. If you do, please stay home and see if it resolves before coming to campus. You may need to see a doctor or get a COVID-19 test.
At school, please be sure you're using hand sanitizer when you enter and exit the building and entering and exiting classrooms. Also, everyone will wear masks and try to maintain 6 feet of social distancing as much as you can. Approximately 6 feet is approximately 2 arm lengths away from your neighbor.
Face masks are your best and greatest protection. They may be cloth, surgical, or N95. If they have a valve on the side, those masks protect only one way. So they protect you, but not necessarily your neighbor. So those that have been discouraged in my readings.
Proper wear of the mask means it'll cover your nose and mouth with a good seal. If you wear glasses, you may need to have your glasses on top of the mask or place tape along the top to prevent fogging. Other tips include cleaning your glasses with Dawn dish detergent or using a defogger chemical wipe.
It is important to know if you're within 6 feet of someone that ends up diagnosed with COVID-19 for a cumulative of 15 minutes over the previous 2 days, you will be considered a close contact for 14 days and have to stay home.
At lunchtime, it'd be preferred for you to sanitize your hands, remove the mask at ear loops, place in a paper bag or Ziploc, wash your hands again with hand sanitizer, and then eat. Once done eating, sanitize your hands again, put your mask on, trying to handle by the loops only as much as possible, and sanitize your hands again. Anytime you are coming in contact with food or masks, wash your hands before and after. By handling by the loops, I mean trying to take it off like this, and then trying to put it back on like this.
Cover coughs, sneezes with tissue and dispose in the trash can. If not available, cover the cough with your elbow and wash or sanitize your hands.
When you wash your hands, wet your hands with warm water, apply soap, scrub for 20 seconds or the time it takes to sing your ABCs in your head, and use lots of friction while scrubbing all parts of your hands, including between your fingers, under your nails, the back of your hands, your palms, and you want to wash all the way to your wrist. When you're done, use the paper towel to dry your hands and use a paper towel to turn the faucet off and open the restroom door.
When using hand sanitizer, you want to use the same friction as washing your hands.
The water fountains at school will be off this year, so please be sure to bring a water bottle to school with you. You want to wash your bottle every day or have a clean bottle every day.
Come to the clinic if you do not feel well.
And when you come to the clinic this year, it will be different than previous years. Right now, Tarrant County is considered to be in a high community spread phase with COVID-19, so there are more protection measures and less flexibility in symptom management measures in place. For example, if you have seasonal allergies, it may be a good idea to start taking your medication now and getting your allergies under control now, so your allergies are not taken as COVID-like symptoms when you come to the clinic when you're at school.
Your nurses will be wearing protective scrub caps, goggles, face masks, and possibly a face shield. Carroll High has a rather large clinic, so the first portion of the clinic is your area to sign in, complete a COVID screening, and get a temperature check like you do when you go to your normal doctor or dentist office.
And remember, the signs and symptoms of COVID that we will be screening for are fever over 100, sore throat, new uncontrolled cough that causes difficulty breathing, or in a person diagnosed with asthma or chronic allergies, a change in baseline, diarrhea, vomiting, abdominal pain, abnormal or absence of taste or smell, new onset of severe headache.
If you have symptoms that could be considered COVID-19 symptoms, you will go to a waiting area to wait for parents to pick you up. Anytime you come to the clinic, bring your backpack so it does not need to be retrieved from the classroom.
If you're coming to the clinic for daily meds, if possible, please bring your own bottle of water. Meds will be handed to the student in the well area of the clinic. Come with your mask on, sanitize your hands, use your own water to take your medication, replace mask, and sanitize hands again. We know it's a crazy time, but we're so excited to have you back on campus. You've all been missed so much, and we really look forward to seeing you on Monday. Bye.